Hello and welcome everyone to our second of 3 Community of Learning sessions. Our series today is Messengers in Health, and our topic is 'Tis the Season to Vaccinate, Flu, Pneumonia, and COVID-19. My name is Tiffany Stark, and I'm NCUIH's Public Health Project Coordinator, and I will be your host today. If you have any technical difficulty during today's session, please chat directly to Comms and Events in the Zoom chat. Finally, if you could, please enter your name, organization, and any tribal affiliations into the chat box so that we can get to know each other and count your attendance. Today's event is based on NCUIH's initiative with the CDC for vaccine equity for our UIOs. And again, welcome and thank you for taking some time to join us today. Also, before we begin, please note that this session will be recorded for educational and quality improvement purposes. NCUIH will be utilizing the recording to continue to share and educate frontline healthcare workers throughout this pandemic. To begin, we'd like to provide a brief background on our organization, the National Council of Urban Indian Health. NCUIH is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for AI and ANs living in urban areas. NCUIH is the only national representative of the 41 Title V UIOs under the IHS and the IHCIA. NCUIH strives to improve the health of over 70% of the AI and AN population that lives in urban areas, supported by quality, accessible healthcare centers. We would also like to acknowledge that this event is supported by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by CDC or HHS or the U.S. government. During this session, we'll introduce you to our project team, today's objectives, a brief lecture by Layla, commonly asked questions with Dr. Mary Owen, and followed by a discussion facilitated by Dr. Owen and Layla as well. And we would begin with an introduction of our NCUIH project team. So we have, Andrew Colwitt, Director of Research and Public Health Programs, Yvonne Ito, our Public Health Program Manager, Melissa Watson, Public Health Project Coordinator, and Lamar Weaver, our Communications Associate. And next, we would like to introduce Dr. Mary Owen. Dr. Mary Owen is a member of the Tlingit Nation. She continues to provide clinical care at the Center of American Indian Resources in Duluth and is the current president of the Association of American Indian Physicians.
Hello.
And next we have Layla Lanier. Layla is a mother of 6 wonderful daughters of the Creek and Cherokee lineage and 6 perfect grandbabies, 2 of which are of Navajo descent. And she has been a nurse for 11 years. Let's move into why we're all here. The Messengers in Health series focuses on vaccine equity for our UIOs. So today's session will be focusing more specifically on flu, pneumonia, and COVID-19. We will discuss the questions surrounding immunocompromised patients and vaccinations. So today we'll accomplish the following. Identify ways to effectively communicate with urban AI and ANs regarding vaccinations, share strategies to help improve trust between urban AI and ANs and healthcare providers, review the importance of vaccinations and why they're needed, and learn the recommended vaccinations for this fall, and also facilitate discussion between healthcare providers and healthcare workers on the recommended vaccinations. And now I'd like to pass the presentation over to Layla to discuss the importance of communication and trust within our AI-AN community.
Hey everybody, it's great to be here with you and enjoy our time together. Hopefully get some great discussion started, not only amongst ourselves, but so that we can take it out to the greater community and bring information, quality information, and hopefully we reach some people and save some lives, keep some folks healthy and happy, and bring that good information back, and we'll just keep circulating. We'll do the best we can. And by that, we need to improve communication. Daily, we're bombarded. I feel like even if we didn't have access to social media or our cell phones immediately, we're bombarded with communication. And many times when I saw a funny meme today, and this guy checked his symptoms on Google or something, and they just showed him coming into a cough, and he said, I might as well just get in here, because he didn't have hope. But when we have quality communication and quality information, we can really take away some of that fear, hopefully, and bring enlightenment and give good information to people who are most deserving. So when we're talking to our patients about COVID-19, we need to make sure that we're reaching them on a level that they understand, and one with empathy. There's been so much loss and death the last 2 years. Some of it is just so, just painful. People aren't even able to grasp it just yet. We have to remember that and come at them where they're at on their journey in this, and make sure we're providing them with the right information and the right resources. If it's an elder especially, ask, do we have permission to discuss vaccines with you? And when they open that door, let's make sure that we're discussing all the vaccines, because truly sometimes they just may not know. And there's a great, chasm between what's presented and what we really know about things. So let's make sure they have the information on all the vaccines. We can listen to their questions, listen to their fears, and what's motivating those fears, and hopefully we can be the source of good information and bring resources to help them out. We have just, unfortunately, along with this pandemic, there has been a mental health crisis just exacerbated. It was there before. It's always been there. It's just somehow in this country we've brushed it under a rug, and it really only comes out in the news when it's too late to help people. Usually, we can meet those people on the road that they're at right now, hopefully, and bring them information not only about vaccines and their comorbidities and why they need the vaccine and why they need to use PPE and stay healthy, but assess their mental health at the same time. What resources are available, so that we can bring that information to them as well. Are you in charge of the slides, Tiffany? Because I am no good at that. I'm just assuming you are.
Oh, that's Lamar, sorry.
Oh, Lamar, thank you. I appreciate you. And like I touched on before, we have to understand our audience. Many times if we're talking to elders, we have to understand that, their place, their role in our community, in our families, and meet them there as well and collaborate. We don't have to be the know-it-alls. We can find out what they think and where they're at, and try to get that information. And then if there's misinformation, we can bring that to the table and discuss that openly, and hopefully gain that respect and give respect back. Our resources are invaluable. We have to know what we have, what we can offer, where we get it, how soon can we get it. Still, I live in a very small town here in Southern Alabama, and there's a lack of resources that's just unbelievable. And I know that I live only 30 minutes from a major town, but they're still quite difficult to get to. So our rural Indian organizations have the same issues. So we need to collaborate and work together with that. And always, always, always get our audience input and feedback. And not only reaching out to our elders, but the people who are taking care of them oftentimes. Many of our rural families and even our urban families, they live together in communities and communal homes. Who's taking care of them? Are they exposed to little children that are in daycare, that are in school? How can we get better resources? And many questions, because the media, the businesses and towns, they're all offering different information. You can come in if you're vaccinated, How do I know this person standing next to me unmasked is vaccinated? There's lots of questions. We need to bring those answers best we can, meeting them where they're at and working collaboratively. Lamar, can you go to the next one? I appreciate you doing that. I'd probably be 10 ahead by now. Building trust is always a foundation for good communication, just across the board. If we're talking to young people in our urban settings, in a school, at a clinic, but especially with our elders, there's been, unfortunately, also an epidemic of mistrust in this nation, rightly so. But we can be a foundation of change, and with good communication and building trust, we can start that journey together. We need to empower our healthcare personnel, absolutely, for sure, engage in partner national professional associations and collaborate with all the groups that are available. We shouldn't exclude one if they're helpful, they have the resources available, and really working together to make sure that our urban organizations know who's available to them. I know Linda works tirelessly. Yvonne, I just happen to know those two very well. I know they work tirelessly to put people together, the right people together. And oftentimes there's resources right in the community that the urban organizations just didn't have the opportunity to know about. So that's just invaluable. You can't put a price on that. And we need to make sure we're having vaccine conversations just laden with empathy. I think that's what's missing mostly in our culture now, other than just pure, love of humanity, but empathy is such a rare thing now. And like I said in the beginning, so many have lost family and loved ones, and I'm talking from a personal standpoint this last 2 years. And when you start to talk about it now, a lot of people just kind of have to put it behind them. Either they're not dealing with the grief, or maybe there's just one or two people that haven't been touched as much. It seems unlikely, that one, but people just aren't willing to talk about it right now. And that is a lot of our mental health, plays a role in that. But we need to have that conversation as well. We need to engage our communities and individuals. Our health departments, our local clinics need to engage with the community. I've heard so many good things from our urban Indian organizations where they've had community vaccine events at their clinics, and they were just, it was just people lined up ready to go. That's heartwarming. That means they're getting the information, they've built the trust, and they've made their resources available. And that's really what we're going to have to do. Unfortunately, the overall thought process is mostly one now of just let's move on, but we're not going to be able to move on until we're healthier and ready to meet this virus and fight it off better than what we are right at this moment. You can go to the next one, Lamar. Thank you. Let's see here. Yes, our rapid community assessment tool. What do people think and feel? Yeah, there's low trust in vaccines. I really feel that's a source of poor information getting to the communities. It's word of mouth. There's been few times in history that the overall voice of the medical community is completely solidified and united about a virus, a pandemic, and therefore the vaccine to prevent it, that the people have completely turned against that and relied on either news media or public officials to give them the right, their right answers. It's just it's just hard to even know how to grasp that. As a nurse, my heart goes out, and I just want to reach out to every single person and give them the right tools to make the right choices and the right information. I solely cannot do that, but together we can collaborate and make that happen. Vaccines aren't being emphasized like they should. People are calling for different preventive measures like herd immunity that takes millions and millions and millions of deaths and sick people, and we don't have to get there by that avenue. There don't seem to be as many barriers in accessing the vaccine as in a shortage. I haven't seen too many reports of shortages, maybe more of getting to the facilities with the vaccine. I know in my beloved rural Alaska, that is an issue. But too, we can facilitate, and we can collaborate, and we can make sure that those vaccines are getting to the people. Next slide. Yes, more vaccination strategies. We've talked about this on our last video, and I feel like we just need to completely follow through with this with each talking circle, within our collaborative communities, and certainly within our UIOs. We need those ambassadors. We need the right people with the right information and resources talking to the people, talking to the community. That's the people they can look to and trust. And it's not so much I bring you answers and resources, it's how do you have access to me afterwards? Am I just a figment of your imagination? I go, wait, no. And that's part of our talking circles. You can reach out to us. You have our email. You can send us an email or text. I don't care. Reach out to me, call me. It doesn't matter. We will be that ambassador. Provider vaccine standardization, our medical reminders, not only for the vaccine that is available now, the multiple vaccines and the boosters that are available now, but our regular vaccines, our flu, pneumonia, there's seem to be, going by the wayside. The pandemic is real and it's still here. But the flu is just as deadly when we have comorbidities and people who are already suffering with, say, respiratory illness or something like that. Vaccination programs located at schools. Most people know children in school, and there's schools in just about every single small community. So that's a perfect example of time and place availability. And not only that, but at a school with appropriate time, and you could space people out and have plenty of room still. Home delivered vaccinations to me are just a fantastic idea. We have hospice nurses, we have home health nurses that could visit in urban situations and get that vaccine out to our members, out to our elders. And workplace vaccination. I've previously worked in hospitals, and I know they would vaccinate us or give us any booster, whatever we needed right then and there at work. And that is so convenient. I didn't have to go to a clinic. I didn't have to take a day off of work. So that just makes good sense. The requirements, they're so wishy-washy. I saw a post today where I believe it was Austria and Sweden were going to do some lockdown requirements, and no one will be allowed in public places that's not vaccinated. Well, now they've kind of crawfished on that just a bit. So we have to stick to our requirements, and it's sometimes the only way. It's kind of like tough love when you have teenagers. It's really the only way to protect those who are working and keeping our economy going as it is, and the people who are directly exposed. We need effective messages delivered by trusted messengers, and that goes back to number one with our ambassadors. We absolutely have to have people that can get the ear of our urban community, of our rural communities, of our community leaders, so that that person they can not only hear the information from, but get back to them for questions, follow-up questions. Because I know sometimes I hear information and I might not have a question until later that evening or later the next day. And how do I get to that person? We need to have access. Combating misinformation is one, I think, of our biggest stumbling blocks in this entire pandemic. And it's hard to find someone who doesn't say, well, I don't know what to believe. Well, that's because there's so much misinformation. You should certainly trust a medical professional. Most people have a medical doctor that they visit, a favorite nurse, even a therapist. Reach out to them, ask them. And if they don't know the answers, I can't imagine they wouldn't be duty bound to find someone who could give you that information. Next slide, Emma. Tiffany, tell me when it's not my turn, because I don't want to run into yours. Our recommended vaccines for this fall are COVID, flu, and pneumonia. You can find those on the CDC link right there, but that's pretty standard for the fall. And generally, I remember working in nursing homes and we were like, okay, when do we really start giving the flu vaccine? Because the CDC had not really said when flu season has started that year. And they said generally it's from when they see a sharp decline of flu and when they see a spike from the year before. Well, that particular year I was working, they didn't see a sharp decline. So it was all year. So we started giving our flu shots, I think in July that year. And I recently asked a doctor that I was talking to about flu this year, and he said he hasn't actually had a case in our small rural clinic there of flu. They just hadn't seen it. So I don't think it's gone away. I'm sure of that. I think that our COVID has just taken us by storm, actually. And it's important to get these 3 vaccines right now as it ever has been, especially for our elder community. Tiffany, I see you. Are we tagging? No.
Yes. Next slide, please. So now I'd like to open the floor up in the chat box to any questions that anybody has based on what we just discussed so far. So thank you, Layla, for that. Really appreciate it. Okay, I don't see any questions right now, so we can move forward with the presentation. So now we would like to get into the commonly asked questions regarding COVID-19, flu, pneumonia vaccines, and also the immunocompromised populations. Dr. Owen, so we have a question. Are COVID-19 vaccines safe even though the vaccines were developed rapidly?
Yes, they are quite safe. In fact, testing or the research being done that was done on the COVID-19 vaccines actually started a lot earlier than when we started seeing the COVID-19 infections, because the virus itself, the virus that causes it, have been known for a while. So that research started long before we were even aware that this was going on. In addition, every drug or every therapy has to go through a 3-phase trial, and those trials were completed on COVID-19, even though they were sped up. They just, because of the essence of time and because of how many people were getting infected, everything just moved so much faster. So yes, these vaccines are as safe as any vaccine we'd have, and I'd argue even more so because so many people were concerned, like the African-American community, for instance, were so concerned about the mistrust in their community that they had their own researchers double check everything. So I feel really safe recommending this for my community, for our Native community, and for anybody. Yes, thank you for the question.
Thank you. The next question we have, what are the ingredients in COVID-19 vaccines?
Another good question. I've been asked this before. I was a little bit surprised by it, but did do some research, and the ingredients are quite benign. They contain the little messenger that's sent to our cells to trigger a response by our own immune system. And in addition to that, they're just ingredients that help stabilize that messenger that's sent into our cells. There are no heavy metals in there, no metals in there at all. There are things like fats and the usual ingredients that we put in our vaccines to, again, stabilize them. There are no microchips, anything scary at all. Things that you could give to a baby and be fine.
Great, thank you. Next, someone said, if I'm pregnant or planning to become pregnant, can I get a COVID-19 vaccine?
Absolutely, especially if you're pregnant, you want to get this vaccine because we still don't know all the impacts that COVID virus will have on pregnancy. We have seen some outcomes, but we don't have enough to put it all together yet. But definitely we know the vaccine is far safer than the chances of infection with COVID virus right now. Get the vaccine. Anybody 5 and older should be getting the vaccine.
Thank you. So another question is, how long do I need to wait after getting a flu vaccine or another vaccine before getting a COVID-19 vaccine?
Great question, especially given the good talk that Layla just gave. You can get them right away. You want to get them right away. You don't have to split them up.
If I already had COVID-19 and I recovered, do I still need to get vaccinated, with a COVID-19 vaccine?
Absolutely. It's a question that I get a lot in clinic, and yes, always you want to get it. You want to make sure that you're not still having symptoms and that you're past your quarantine time, but then after that, go ahead and get in there and get vaccinated.
Can I get vaccinated against COVID-19 while I'm currently sick with COVID-19?
Yeah, that's the question I just meant to answer, but you want to make sure your symptoms are done and you're past quarantine. But I just had a friend who's just took her kid in. As soon as she hit that quarantine, post-quarantine mark, she took him in and got him vaccinated. Definitely.
So another person had asked, can I choose which COVID-19 vaccine I get?
Yes. I recommend you go and get whichever one is available because they've all been efficacious. We know they're all great. We're seeing more and more that the Johnson, we thought it wasn't as effective, but we're finding out it is indeed has great effectiveness. It's still for people who aren't, as Layla mentioned, able to get in for easily to clinics. That's if you can get that one, get that one. But they're all recommended, and we now know that the boosters, don't worry about the boosters, and when you're going to need it, they can be intermixed as well. So
great.
And that leads in. Go ahead. Sorry. Go ahead, Tiffany.
Oh, no worries. That leads into the next question. So how many doses of COVID-19 vaccine will I need to get, and do I need a booster?
Yeah, 2 doses for the Moderna, Pfizer, and Johnson & Johnson, but they're separated on the Moderna and Pfizer. Those are commonly called mRNA vaccines. And for those ones, you wait 4 weeks. Correct me if I'm wrong, Layla. And then 3 weeks for the Johnson & Johnson. I believe I have those right. We do this so often, but yet we have so many numbers running around in our heads all the time. So I always double check all this stuff, but those sound right to me. And then yes, the boosters are also a little bit different on the timing. You can get a booster for the Pfizer and Moderna. I believe it's 6 months, and I want to say 2 months after the Johnson & Johnson. Does that sound right, Layla? Yeah, great. And you get right now, the CDC is recommending the boosters for folks who are still recommending it for folks who are immunocompromised or 65 and older. It won't be too long, I think, that everybody's eligible. We are starting to see some waning of the effect of the immune system by the immune system. So it'll be pretty important for us to get up to date pretty soon.
Thank you. So another question is, if I didn't get my second shot of a 2-dose COVID-19 vaccine within the recommended time, what should I do?
Get it when you can. Just get in there and get that second dose. We see that a lot in clinic, actually, where people, for whatever reason, for one vaccine or another, weren't able to make that mark. We just want to get you when we can and help you out.
Great. How long does protection from a COVID-19 vaccine last?
We don't fully know yet. Some people we know, people who are immunocompromised, don't hold on to that. Well, they don't even get a good blast of immune in the first place. Sometimes, not always, but sometimes they don't. And so we give them what's called an additional dose. But for the general population, we know that it's going to wane. We don't know exactly when. And I'm guessing there's always going to be some individuality, but in general, if you are at that 6 month and you're okay to get the booster, get that booster. If you're 65 and older, or you're immunocompromised as per the CDC recommendations, that's the time to get it, because we just don't know. We don't have good information yet on how long that's lasting. We do know from what we're seeing in the Southwest and other areas, though, that for people it is definitely waning. So if you're eligible for the booster, get the booster.
Thank you.
Mm-hmm.
So another question, if I lose my COVID-19 vaccination card, how do I get another one?
Go where you got it in the first place, ask them for it. And if they don't have it available, find out. Usually the state or the state departments of health are going to have them, your county office, whoever has been monitoring that. And you can bet we're doing a better job of that than we used to now.
And the last one for the COVID-19 vaccination question, do I need to wear a mask and avoid close contact with others if I'm fully vaccinated?
It's such a good question, and I wish more people were asking it, because we are in Duluth, Minnesota, where I live right now. We're in a high-risk area, and yet our governor, for whatever reason, has not declared and made sure that people are wearing masks in public places as they should be. The CDC has recommended when you're in a high-risk place, put that mask on whenever you're in public. Outdoors, it's a little bit different, but I work in a healthcare setting, and I come back home to my family. I'm around people who are going to be vulnerable. I wear a mask. I'm outside, I wear a mask. I'm in a store, I wear a mask. And remember that the mask isn't necessarily protecting you, but it's protecting other people that you get around, right? If you need to be protected, you definitely want to have on those tighter, better fitting masks, for instance, if you're immunocompromised, and then just protecting yourself by not going into those public spaces. You can ask your family to do those things, or ask your community. That's the beautiful thing about being Native. We generally can rely on one another a little bit more. Thanks for the question.
Thank you. Next slide, please. I must have got stuck, but we'll keep going. So now we're going to move into our flu vaccination questions. So the first question, what's new for the 2021 and 2022 year?
Are these for me, or are they for Layla, these questions?
This one's for you, or
Okay.
Layla, I guess.
Okay.
But primarily you.
Well, the flu vaccine changes, it's monitored, the vaccine is monitored and changed according to what the latest are that our scientists are finding as far as the flu that's out there, what they suspect or what they're seeing as far as the flus, the different forms of the virus that are out there in the community. So it's a quadrivalent, I'm not even so sure if I'm saying that right, but basically a 4-part virus, and it has a component of the different sorts of influenza viruses that they're seeing in our community, or they suspect are going to be there in our community. So really important that people get vaccinated against the flu. As Layla said, I have the suspicion that, or I have the sense that people don't think that it's as bad. We can't let our guard down on one virus because another one's bad. Please get the flu virus. It can kill, as Layla mentioned, particularly if you're immunocompromised or older. I have seen people with deadly forms of influenza.
Thank you. The next one is, what is the difference between flu and COVID-19?
Flu is infection, as is COVID-19. They're both infections, but they're caused by different viruses. So flu is caused by the influenza virus, and COVID-19 is caused by the SARS-CoV-2 virus. So different infections. They both have similar symptoms, and they both can end in pneumonia. The main difference is that that I think of is that COVID or SARS-CoV or COVID-19, think SARS-CoV, that's the virus itself, is more infectious, and in that it's more easily spread. And we know that it's causing more mortality, more death, far more, probably we think about 10 times more. So now normally influenza will kill about 600,000 people per year. We know that COVID-19 has already killed, oh, what is it? The last time I had a slide with it, like 7 million. I mean, it's crazy. It's again, about 10 times. So both infections, in flu and COVID-19 caused by viruses, one influenza, the other one SARS-CoV-2, they both cause symptoms that you think of like a cold, very similar, a little bit of difference, like maybe it's more common to have loss of taste or smell, for instance, with COVID-19. Both can lead to pneumonia. One is much more likely to be deadly than the other, but both can lead to pneumonia, both can kill, both need to be vaccinated against.
Great, thank you. The next question is, can I have flu and COVID-19 at the same time?
Yes, that would be unfortunate, but yes, definitely. Again, another reason to get vaccinated. There's a theme here.
Next slide, please. So now we're going to move into the pneumonia vaccination. And the first question being, are there vaccines that can lower the risk of getting pneumonia?
Absolutely. The main one is pneumococcal, which our little people get now really early, all the way up to age 2. And then if you're late, you can, we'll fix that problem too. And then you can get them again commonly at age 65 and older. You might get them in between depending on your risk factors and your discussion with your providers. Those are the common ones. Also, of course, the flu vaccine helps prevent pneumonia as well. Those are the main ones that you want to make sure that you get covered for to help prevent pneumonia. And of course, COVID-19.
Great. Does pneumonia affect all ages?
Yes, even yeah, littlest people can get pneumonia. And remember, pneumonia, all pneumonia is just an inflammation of the lungs. So something's going on in the lungs that's causing you to be sick. Usually it's a infection, oftentimes caused by one of these viruses, but it also can be caused by a bacteria and some other atypicals that are similar to bacteria.
So who is more likely to get pneumonia?
Are you asking me, are you giving me some choices or just in general?
In general.
Older
Sorry.
folks, 65 and older, or people whose immune system doesn't work as well. We call them immunocompromised. And that would include people who are on medications that help boost your immune system, like steroids. People who are chronically ill from other things, like people who get sicker are the people who have chronic illness like diabetes, cardiovascular disease or heart disease, liver disease. Any of those chronic illnesses can make you more susceptible because your body's already working hard to take care of itself. And now you've got an added stressor. Layla, remember to jump in if you think I missed anything.
I wouldn't dare. No, ma'am. You've got it completely under control.
Thank you, ladies.
My grandbaby just turned 10 months old. And the other day, her mom took her in for just her regular checkup, and she got her pneumonia vaccine then as well. And I know I'm a mom of 6 kids, and mine didn't get a pneumonia vaccine when they were little. Thankfully, they got pneumonia, but I'm so grateful that her mom, was willing to allow the vaccines. And of course, she hasn't fought that. But her mom, while she was pregnant with Everly, had COVID vaccine, had COVID, and so did her husband. And they were very ill. They had the loss of taste and smell, and it took months for that to come back. And of course, baby girl's healthy and strong, but her mother's making sure that continues. So
excellent.
That's great. Thank you for sharing.
Those stories are really important.
And now we're going to move into the next section on immunocompromised. So the first question being, what should immunocompromised people who received Johnson & Johnson's vaccine do?
You mean as far as?
So I guess there was hesitancy initially because of like blood clots with that. So I guess now moving forward, what should they do, especially with like the boosters?
Well, people who are immunocompromised are generally getting their next shot anyway. They're getting an additional shot like 28 days afterwards. And I don't believe that the CDC has recommended the booster on top of that extra shot. So they should be following those guidelines. I don't have for you the exact information. You can find it at CDC on Johnson & Johnson. I believe Johnson & Johnson was not yet approved for that additional, but I'm not quite certain about that one. I'd have to double check that one.
Great, thank you.
Mhm.
The next one is, what are the benefits of people receiving an additional vaccine?
So again, talking about immunocompromised folks, we know that there are two things that can happen when you're with the vaccine. You could either not mount, or that would make you more susceptible to COVID-19. You could not mount a response in the first place. Your immune system won't kick in the first place, or your immune system might wane. It might not last as long, the effects of your immune system. Remember, your immune system are basically warrior cells inside your body, ready for infection, ready to fight that infection off. And these vaccines, they're messages that come in and tell your cells, kick it up. There's something bad out there, get ready, get going. And for some people though, those messages are not well received, or the immune system isn't able to kick it up. They're just kind of tired warriors, so to speak. And so they can't fight things off. So that person might need, if they're immunocompromised, an extra dose, like that extra dose 28 days after, and that will kick their system into gear finally. For other people who were able to mount a good system, their warrior cells got going after fighting for so long, or being on at the gates ready for so long, they get tired. So that's when the booster comes in, and it kicks that system back into gear, gets new warriors going, so to speak.
Perfect. Thank you.
Mhm.
So what are the risks of vaccinating individuals with an additional dose?
We haven't seen any problems with that so far. This again, just like with the formation of these vaccines, they're being watched constantly for any potential problems with them. And so far they've been safe, no problem. So if you are going to, you got to think about the odds. You always got to be thinking about the odds. Your odds of getting sick, if you're immunocompromised, getting sick and dying from COVID-19 are so much greater than anything happening from these vaccines. So get vaccinated, get the extra according to your need and what your doctor's recommending for you.
And the next one is, what is the difference between an additional dose and a booster shot? And this one I've been seeing a lot.
That's what I just mentioned. The additional dose is when people's immune systems don't get kicked into gear. They're not able to, like I said, they might have their immune system's a little more tired and needs an extra, and that 28-day boost will help finally make them come alive and do their job. So it's generally not folks who are younger and healthier like us. It's funny, I consider myself younger and healthier, but anyway, it's for folks who are immunocompromised, who they have chronic disease that's really knocked out their system. Not even chronic disease. These people are really immunocompromised because they either have cancer or they have something like lupus, one of the diseases that will affect their immune system, right? But for everybody else, the difference is they get a booster because their immune system was able to work, did just fine for so long, but then it got tired. So that booster helps kick it back into gear and say, let's freshen up, let's be ready. Does that make sense, Tiffany?
Yeah, thank you.
Okay.
And then the last one is, so if I'm immunocompromised, do I need to have an additional dose and a booster shot?
Well, the CDC is not recommending both at this time. It's one or the other, I believe, unless I'm wrong, Layla. My last reading I did said you get the additional dose if you're immunocompromised, and then you, so far, not on the booster.
To complete the series, that's right, and
yeah,
give your body the best fighting chance it can.
Great, thank you so much.
Mm-hmm.
So now we would like to move into our open discussion with both Dr. Mary Owen and Layla to answer any questions from the audience following this lecture and the commonly asked questions.
Those were so many great questions and great answers.
Okay, so there is one question that has come in so far. Somebody asked, is it possible to have COVID-19 and pneumonia at the same time, or can COVID-19 turn into pneumonia?
Yes, COVID-19 can turn into pneumonia. COVID-19 can cause, or COVID-19 or the virus that causes COVID-19, SARS-CoV-2, can cause a pneumonia just as influenza can cause a pneumonia. Important to recognize that pneumonia is that process, that inflammation in the lungs that's oftentimes viral, that can usually be viral or bacterial. So these two viruses, influenza and SARS-CoV, can cause a pneumonia. Does that make sense?
Yes, thank you so much. Oh, was somebody speaking? I apologize.
You're good.
Oh,
Okay, but I have a question if you got it. I figured I'd ask some questions that I get. I'm never always sure how to respond. I guess one of them is often from, either friends or family. I hear, oh, I need to get the flu shot or the pneumonia shot, but it's pretty late in the season and I feel like it's not, like I'm behind. So I guess the question is, when is it too late to get the flu vaccine in the flu season? When does flu season stop? When should I not get vaccinated for the year anymore?
That's gonna, a couple of things. One, it depends on, mainly it depends on what's going on in your area. Some areas will have be hit by the flu later, and your doctor will have an idea of that, and your clinic will have an idea of that. So if you're still, your community, even if it's in March and for whatever reason your community is still having an outbreak of flu, then you should still get it. But if that, if they think it's long past in your community, then usually people don't get it long after March is what I have seen. I don't know if there is a too late. You'd want to talk with your doctor about that.
Okay, so it sounds like definitely all the way through March at least, and still talk to your doctor. Is that what I'm hearing?
Yep. Yep.
Okay.
Yep.
Cool.
Well, the reason you're talking to your doctor, I mean, it's people laugh because we always say that, but it's because your doctor hopefully is up to date on what's going on in your community. I mean, I don't know what's going on over in Seattle. I don't live there. So I take care of Duluth patients. Layla, anything to add?
No, ma'am. That's absolutely on point. It's never too late to be safe and take care of your body and stay up on vaccinations. And who knows, this pandemic is continuing to go. It's like on a cycle. The flu may very well kick in and do that too. We don't know. It's never too late to get the pneumonia shot. You can get pneumonia anytime. It doesn't follow ahead or behind COVID or the flu. You just stay safe, get the recommended vaccines, and have communication with your medical professionals in your community. Thanks,
Andrew.
Thank you. I have one more question that I actually hear a lot, which is someone will ask me, do I even need to get the flu vaccine if there's no outbreak in my area in November or December? Because, for instance, last year, a lot of people asked this because there were fewer flu outbreaks because of social distancing, most likely. So I've been getting this question a lot this year. I'm not always sure how to respond.
It wasn't just social distancing that kept flu down, though. A lot of people did get vaccinated against it. So what they were doing, a lot of our community is protecting one another. And also, just because you're not aware of flu being in your community, we've seen now how fast these viruses exchange between people. So that it is a false and a scary premise to think that just because you're not seeing it, that it's not going to be there. Absolutely. And remembering, we're not just doing this for ourselves. We're protecting the people around us. You don't want to be a vector for another virus and carry it to others.
Thanks so much. That's great advice.
Thank you. So there is another question. Is it safe to mix and match the COVID-19 vaccines? Like if I receive Moderna, can I get Pfizer as my second dose?
I don't believe we're recommending it for your second dose. You can get a different one for your booster, but not the second dose as far as I'm aware still. Layla, anything different?
No, ma'am, that's exactly it. Absolutely. We don't want to mess up any kind of series. If there's two, you want to stay with that same brand. And then hopefully if boosters are needed, you can talk to your doctor about that booster follow-up.
Great, thank you. And then there's another one. So this one's regarding our elders. So what should an elder do if they're having an issue finding a high dose flu vaccine?
You mean a flu vaccine in general?
Right, yes.
That's what they mean. I think in that case, if your local clinic's not offering it, your health department should be able to tell you where they're available. Also, if you're close to a place, and not everybody is, I know this for a lot of our rural folks, but Walgreens, those common drugstores now, Walgreens and CVS, I believe those oftentimes will carry them. So find out, you can call them and ask them if they have it available. But also, again, I think the state departments or the departments of health should know which clinics have them available and whether or not you can access them. Those are the main ways that I know of. Any others that you guys know of? Anybody on here could answer that one. No? Okay. Also ask your friends and family to do that. If you're an elder, make them get to work for you. That's what they need to be doing, taking care of you.
That's right. That's right. Use your resources.
Yep, and your clinic, even if they don't have it available, they should be able to, the case managers for your doctors should be able to look that stuff up. Yeah. I'm guessing they would be more than happy to. I know ours would.
Yeah, absolutely.
Nurses.
Thank you. And then this next question I've heard a lot too, I guess, are there any implications in getting more than 2 vaccines at one time?
You mean like you accidentally went to another clinic and got the, I'm not following. What happened?
Oh, so I guess this person means, I guess they're hesitant in a way if they're getting like 2 vaccines at one time.
Two different.
Yeah. Yeah.
Sorry. I think I'm tired. No, there's no problem with getting 2 vaccines. That was one of the questions that was asked earlier, but a really important one. Yes, you can get them at all at the same time. Just get it done with. You want to, we try to get people in our clinics, get everything taken care of that we can at once.
Yeah, absolutely.
Great.
If they think about it, when, little ones are getting vaccinated, they usually are tandem, we're going to do 1 in this leg or 2 in this leg and 1 in this one. And if it's safe for a baby, it's certainly safe for our adults and elderly. And, your doctor, your nurse practitioner, your nurse that comes out to your home or whatever, will have that most up-to-date information and glad to share it with you. And, will go out of their way not to put you in harm or suggest something that would cause more harm to you health-wise. So, always ask and ask your trusted medical professional. But we give them to babies all the time, back to back, and they were already going to be grumpy, so that little bit of extra grumpy will be just fine.
That's a really good point. I can't believe I hadn't thought about that. Another question that I get asked all the time is, I'm sick, I got a cold, can I get influenza? I used to be a lot nicer about this and say, no, you don't have to. Not anymore with what we're seeing in the world around us. If you're a little bit sick, you can still get this. If you're really sick, it's a different story and we'll talk about it. But it should not, a little bit of sick with a cold and stuff should not prevent you from getting these critical vaccines.
Absolutely. Time is of the essence now. And, generally, if you're just a little uncomfortable or had the sniffles, that's not anywhere near as bad as dealing with COVID or pneumonia. So go ahead and, take advantage of the opportunity.
One thing we didn't talk about here is the impact of that we don't even know the long-term impact of COVID-19. And I don't want to scare people who've had it, but it's important that we be aware that we know that some people have long-term sequelae, long-term consequences of having COVID-19. So we need to stop this altogether. Less people get that, the better.
That's right. Good information and using resources and collaboration. I feel like we can absolutely do that, but we just have a mountain against us, but that won't stop us anyway from trying.
Mm-hmm.
True. Okay, I don't see any more questions, so we could proceed with the next slide. And again, I want to thank both Dr. Mary Owen and Layla for providing all these great resources, information. Really appreciate it. Super helpful. And so thank you everyone for your participation today. Excuse me. We'd also like to remind everyone to please follow the link provided now in the chat to our survey for an evaluation. We do appreciate your time and your comments. And how better we could serve you, as well as any additional questions you may like. And then we would also like to give the remaining date of our final Community of Learning on December 15th. It's a Wednesday from 3:30 to 4:30 Eastern Standard Time. And this Messengers in Health will be on vaccination, myths versus facts. And then also we would like to let everyone know about the Be a Good Relative campaign, the ambassador opportunity. So we are looking for 3 UIOs who are federally funded Title V programs, and they will help encourage the urban AIAN community and healthcare providers to be a good relative and get vaccinated for influenza. And the link for the application will be included in our email following the presentation. And then also, which I think it's a little stuck, there might be a lag, sorry about that. We would have our sources and our resources listed for you as well, and that will be included in the email. And again, just thank you everyone who had joined. We really appreciate your time, your questions. This was super helpful, and we hope it was helpful for you.